easy, moderate, hard scenario-based. The most common type of hearing loss in chronic otitis media is A. Sensorineural hearing loss. B. Conductive hearing loss. C. Mixed hearing loss. D. Central hearing loss. White heavy checkmark. Correct answer, B. Conductive hearing loss. Explanation. In chronic otitis media, sound conduction through the middle ear is impaired due to perforation or ossicular damage. Inner ear remains intact initially. Past one-liner, commonly causes conductive hearing loss. Rinne test is positive in A. Conductive hearing loss. B. Sensorineural hearing loss. C. Otitis media. D. Impacted wax only. White heavy checkmark. Correct answer, B. Sensorineural hearing loss. Explanation. Positive Rinne means air conduction is greater than bone conduction, which is normal and also seen in sensorineural deafness. Past one-liner, positive Rinne equals ACBC. Weber test lateralizes to the affected ear in A. Sensorineural hearing loss. B. Conductive hearing loss. C. Presbycusis. D. Acoustic neuroma. White heavy checkmark. Correct answer, B. Conductive hearing loss. Explanation. In conductive deafness, environmental sounds are masked less, making bone-conducted sound louder in the diseased ear. Past one-liner, Weber lateralizes to bad ear in conductive deafness. A patient presents with severe ear pain on pulling the pinna. Most likely diagnosis: A. Otitis media. B. Otomycosis. C. Otitis externa. D. Labyrinthitis. White heavy checkmark. Correct answer, C. Otitis externa. Explanation. Pain on tragal pressure or pinna movement is classical for otitis externa due to inflamed external auditory canal skin. Past one-liner, tragal tenderness. Otitis externa. Common organism causing malignant otitis externa: A. Staphylococcus aureus. B. Streptococcus pyogenes. C. Pseudomonas aeruginosa. D. Candida albicans. White heavy checkmark. Correct answer, C. Pseudomonas aeruginosa. Explanation. Malignant otitis externa is an aggressive infection usually seen in diabetics and caused by Pseudomonas. Past one-liner, diabetic with severe otitis externa suspect Pseudomonas. Black fungal spores in ear canal are characteristic of A. Candida. B. Aspergillus niger. C. Muca. D. Actinomyces. White heavy checkmark. Correct answer, B. Aspergillus niger. Explanation. Aspergillus niger produces black spores and is a common cause of otomycosis. Past one-liner, black debris in ear. Aspergillus niger. Cerumen is produced by A. Sebaceous glands only. B. Sweat glands only. C. Ceruminous and sebaceous glands. D. Hair follicles. White heavy checkmark. Correct answer, C. Ceruminous and sebaceous glands. Explanation. Ear wax is formed from secretions of modified sweat glands, ceruminous glands, mixed with sebaceous secretions. Past one-liner, cerumen equals ceruminous plus sebaceous secretions. Most common symptom of impacted wax: A. Vertigo. B. Otorrhea. C. Hearing loss. D. Facial palsy. White heavy checkmark. Correct answer, C. Hearing loss. Explanation. Impacted wax blocks sound conduction, causing conductive hearing loss and ear fullness. Past one-liner, wax impaction commonly presents with deafness. Ear syringing is contraindicated in A. Otitis externa. B. Wax impaction. C. Tympanic membrane perforation. D. Otomycosis. White heavy checkmark, correct answer. C. Tympanic membrane perforation. Explanation. Syringing can push water into middle ear, causing infection and vertigo if TM is perforated. Past one-liner. Never syringe perforated ear. Common site for foreign body lodgement in ear. A. Middle ear. B. Isthmus of external auditory canal. C. Mastoid cavity. D. Cochlea. White heavy checkmark, correct answer. B. Isthmus of external auditory canal. Explanation. The canal narrows at the isthmus, making it the usual site of impaction. Past one-liner. Foreign bodies commonly lodge at canal isthmus. Button battery in ear requires A. Observation. B. Immediate removal. C. Oral antibiotics only. D. Hearing aid. White heavy checkmark, correct answer. B. Immediate removal. Explanation. Button batteries cause liquefaction necrosis and tissue damage rapidly. Past one-liner. Battery in ear equals ENT emergency. Cauliflower ear develops due to A. Otitis externa. B. Auricular hematoma. C. Otomycosis. D. Cerumen impaction. White heavy checkmark, correct answer. B. Auricular hematoma. Explanation. Untreated hematoma causes cartilage necrosis and fibrosis, producing cauliflower deformity. Past one-liner. Wrestlers commonly develop cauliflower ear. Perichondritis of pinna usually spares A. Helix. B. Antihelix. C. Lobule. D. Concha. White heavy checkmark, correct answer. C. Lobule. Explanation. Lobule lacks cartilage, therefore perichondritis usually spares it. Past one-liner. Lobule spared in perichondritis. Most common cause of conductive hearing loss in children. A. Presbycusis. B. Otitis media with effusion. C. Acoustic neuroma. D. Noise trauma. White heavy checkmark, correct answer. B. Otitis media with effusion. Explanation. Fluid in middle ear interferes with sound conduction in children. Past one-liner. Glue ear causes childhood conductive deafness. Presbycusis is A. Congenital deafness. B. Age-related sensorineural hearing loss. C. Conductive hearing loss. D. Sudden deafness. White heavy checkmark, correct answer. B. Age-related sensorineural hearing loss. Explanation. Degeneration of cochlear hair cells with aging leads to bilateral SNHL. Past one-liner. Presbycusis affects high frequencies first. A diabetic elderly patient has severe nocturnal ear pain and granulation tissue in canal. Diagnosis. A. Acute otitis media. B. Malignant otitis externa. C. Otomycosis. D. Wax impaction. White heavy checkmark, correct answer. B. Malignant otitis externa. Explanation. Severe pain, diabetes, and granulation tissue strongly indicate malignant otitis externa. Past one-liner. Granulation at bone cartilage junction malignant OE. The tuning fork commonly used in ENT is A. 128 Hz. B. 256 Hz. C. 512 Hz. D. 1024 Hz. White heavy checkmark, correct answer. C. 512 Hz. Explanation. 512 Hz tuning fork gives optimal sound decay and minimizes vibrations felt tactilely. Past one-liner. Standard ENT tuning fork equals 512 Hz. Sensorineural hearing loss occurs due to lesion in A. External ear. B. Tympanic membrane. C. Cochlea or auditory nerve. D. Ossicles. White heavy checkmark, correct answer. C. Cochlea or auditory nerve. Explanation. SNHL results from pathology involving sensory hair cells or neural pathways. Past one-liner, SNHL involves inner ear or nerve. Most common symptom of otomycosis. A. Severe bleeding. B. Itching in ear. C. Facial palsy. D. Fever. White heavy checkmark. Correct answer, B. Itching in ear. Explanation. Fungal infection of external canal classically presents with intense itching and blocked sensation. Past one-liner, pruritus is hallmark of otomycosis. Which hearing loss benefits most from cochlear implant? A. Mild conductive loss. B. Severe bilateral sensorineural deafness. C. Otitis externa. D. Wax impaction. White heavy checkmark. Correct answer, B. Severe bilateral sensorineural deafness. Explanation. Cochlear implants bypass damaged hair cells and stimulate auditory nerve directly. Past one-liner, cochlear implant for profound SNHL. Most common organism in acute otitis externa. A. Pseudomonas. B. Proteus. C. E. coli. D. Klebsiella. White heavy checkmark. Correct answer, A. Pseudomonas. Explanation. Pseudomonas thrives in moist external auditory canal and commonly causes swimmer's ear. Past one-liner, swimmer's ear Pseudomonas. A child inserts a pea into ear. First-line management. A. Syringing immediately. B. Observation. C. Removal under visualization. D. Oral antibiotics. White heavy checkmark. Correct answer, C. Removal under visualization. Explanation. Vegetable foreign bodies swell with water, syringing should be avoided initially. Past one-liner, avoid syringing vegetable foreign bodies. Which condition causes mixed hearing loss? A. Otosclerosis. B. Presbycusis. C. Wax impaction. D. Otomycosis. White heavy checkmark. Correct answer, A. Otosclerosis. Explanation. Otosclerosis may involve stapes fixation and cochlear involvement producing mixed loss. Past one-liner, otosclerosis may progress to mixed deafness. The external auditory canal is lined by A. Columnar epithelium. B. Cuboidal epithelium. C. Stratified squamous epithelium. D. Transitional epithelium. White heavy checkmark. Correct answer, C. Stratified squamous epithelium. Explanation. The canal skin is continuous with outer tympanic membrane and contains hair follicles and glands. Past one-liner, EAC lined by keratinized squamous epithelium. Common complication of untreated perichondritis. A. Facial palsy. B. Cauliflower deformity. C. Vertigo. D. Meningitis. White heavy checkmark. Correct answer, B. Cauliflower deformity. Explanation. Cartilage destruction and fibrosis produce permanent deformity. Past one-liner, untreated perichondritis deforms pinna. Which hearing test is most accurate? A. Rinne test. B. Weber test. C. Pure tone audiometry. D. Whisper test. White heavy checkmark. Correct answer, C. Pure tone audiometry. Explanation. PTA quantitatively measures hearing threshold and type of hearing loss. Past one-liner, gold standard hearing assessment equals PTA. Sudden sensorineural hearing loss is treated with A. Wax removal. B. Steroids. C. Antifungals. D. Syringing. White heavy checkmark. Correct answer, B. Steroids. Explanation. Early corticosteroids reduce inflammation and improve chances of hearing recovery. Past one-liner, SSNHL is ENT emergency. Most common complaint in auricular hematoma. A. Itching. B. Swelling of pinna after trauma. C. Vertigo. D. Otorrhea. White heavy checkmark. Correct answer, B. Swelling of pinna after trauma. Explanation. Blood collects between cartilage and perichondrium after blunt trauma. Past one-liner, trauma plus pinna swelling equals auricular hematoma. In conductive deafness, bone conduction is A. Reduced more than air conduction. B. Equal to air conduction. C. Better than air conduction. D. Absent. White heavy checkmark. Correct answer. C. Better than air conduction. Explanation. Bone conduction bypasses middle ear pathology, making BCAC. Past one-liner, negative RINAIR in conductive loss. A patient